Furthermore, when we have a definitive diagnosis that we have the patient who is suffering from Cushing syndrome, we want to have the further differential diagnosis, and we want to work on the particular fact that what kind of an ectopic tumor we are dealing with. So the set of signs and symptoms and the labs are going to reveal a lot of factors in this particular case. The differential diagnosis of ACTH-dependent Cushing syndrome is discussed over here. First of all, the etiologies. It can be the pituitary corticotrope adenomas. So it can be the pituitary gland which is responsible in particular over here. And we have basically, when we look at the ratios, the females are more prone to the development of the pituitary corticotrope adenomas. Then we have the clinical features which show a slow onset of signs and symptoms. The serum potassium levels are more than 3.3 micrograms per deciliter in almost less than 10% of the patients. The 24-hour urinary free cortisol is quite high in these patients. The baseline ACTH levels are inappropriately high. The dexamethasone suppression low and high dose tests are performed. The cortisol levels are more than 5 micrograms per deciliter, and the cortisol levels are sometimes less than 5 micrograms per deciliter in this circadian rhythm that is being followed in these particular patients. The urinary free cortisols are mostly 80% suppressed. Microadenomas show a 90% and macroadenomas show a 50% suppression in these cases. The basal CRH induced levels of IPSS are almost more than 2 or more than 3 in these particular cases. Now, on the other hand, if we are dealing with any kind of an ectopic tumor, bronchial, abdominal, carcinoid tumors, usually males are more affected by these kind of tumors. There's a rapid onset of pigmentation, severe myopathy is observed in these patients. The serum potassium levels are more than 3.3 micrograms per deciliter in almost 75% of the patients. So it's basically a clinical feature of bronchial carcinoid tumors. 24-hour urinary free cortisol is high. Basal ACTH levels are very high. Dexamethasone suppression test basically shows cortisol more than 5 micrograms per deciliter, and in a circadian rhythm it can even show cortisol levels more than 5 micrograms per deciliter. Then we have the urinary free cortisol, more than 80% suppression in almost 10% of the patients. The basal IPSS and CRH-induced IPSS is less than 2 or less than 3 in these patients. So this is a complete, basically comparative study between the pituitary corticotrope adenomas and with the patients who are suffering from the bronchial abdominal carcinoid tumors. This is very helpful when you have these patients. You know that this is an ACTH secreting tumor, and you have this differential whether it is ectopic or whether you are dealing with the with the pituitary adenoma in general. So it would be very helpful when you compare the lab investigations and make a definitive diagnosis for these particular patients.